I was in a workshop with a client and it brought a lot of laughs at the time. And I dared to suggest that I could imagine a time where primary care doesn't exist, because we would go from diagnosis and having the equipment and the data and the wearables and straight through to secondary care. You think about the very definition of a GP in English terms, general practitioner. They need to know a little bit about a lot of topics and ailments and conditions, most of which we now have accessible on Google and various other social channels and whatnot.
Hi everyone, welcome back. I'm Sonika Garcia.
And I'm Brad Davidson, and this is Breaking the Code,
a podcast series addressing misconceptions related to the discipline of behavioral science. We hope to arm you, our listeners, with the tools you need to make sense of behavioral science and to help you apply it to your work as communication extraordinaires.
So today we are lucky enough to have the busiest man in showbiz, Dan Weaden, the new CEO of Havas Consumer Health. Welcome, Dan.
Thank you, Brad.
So I've known Dan since I got here, really, about 8 years ago. Dan has been here at the Havas Network for almost 12 years. He's recently been elevated to CEO of this new division that we've created. And before that, he's been in a lot of different advertising roles over 20 years. He's a strategist like us. He came up through the ranks of strategy. He's got interestingly, a master's in fashion marketing, which we'd love to talk about some other time. But, before we began this podcast, we were chatting about that. And it's really about brands and branding and about how, self is brand, clothing is brand, fashion is brand. And there are some sort of intersections between healthcare marketing and other types of marketing. And then there's some unique elements to marketing health products and brands, and are they even brands? And so we've invited Dan on today, really with a couple of aims. One is he's a very interesting, entertaining person, so we'd have him on just to talk about the weather. But he's really here today to talk about the new role, the goal for the new division, and also what does it mean, in health and healthcare that we actually have a division like this. We didn't always have healthcare divisions per se. We had, agencies that were sort of consumer packaged goods marketers, and they would do something for over the counter. You got sniffles, got a cough, buy Coldies, buy whatever, Durex, something like that. These are health adjacent products. And then you've got sort of hardcore healthcare agencies, I would say, the ones understand the ins and outs of the legal ramifications, for example, of advertising prescription drugs, who understand the deep science, who are really advertising to working professionals, doctors, nurses, the rest of them, who are viewing these products as tools, not really as end consumers, but users. So it's a little bit like advertising drills to home builders, right? Like it's not the same as advertising Coca-Cola or something like that. There are some very technical differences. And so this sort of middle ground, I think, is the first thing we'd really like to hear from you about, Dan, is like, what's the role of the agency? And then I think, as strategists, as we really want to hear like what it means, like why are we doing it, what it means, where we go. So
yeah, it's a really interesting time for us, and what you've talked about there really speaks to the conception of this idea of a dedicated consumer health agency and proposition as a network. We didn't really have it before. You're right. In the consumer health space, we had HCP focused agencies, the RX, if you like, agencies, and of course FMCG agencies as part of the vast network. But what we saw was this opportunity that had the best of both worlds, if you like, the strategic, the creative, the media channel understanding and prowess that you'd expect from a consumer agency, but also the know-how. How do you engage with healthcare systems, healthcare professionals? How do you understand the healthcare dynamic as well? And that was really important. In many ways, it reflects my own background. So prior to joining Havas 12 years ago and working in healthcare agencies, I was working in FMCG. I was working on consumer goods, everything from ice creams to rail travel to banking. So having that blend of both worlds has been really important to us. And we've built an agency of talent that have had both feet in both camps there. So really get the understanding of how people are consuming and acting as consumers, and how do we engage and speak to them, but also recognizing the role of the healthcare systems and healthcare professionals. And that's really important. I mean, the premise here is to say that more than ever, we are taking more and more control of our own health, in this era of self-care, if you like, and we're making our own health choices and decisions. And that's been driven by technology, by data that's available at our fingertips, TikTok tutorials, by Dr. Google, by peer groups and social media. So we're making more and more decisions about our own health. The role of the healthcare professional is still very relevant, though, because in certain instances, you would go to a healthcare professional for a point of view or for a recommendation. If I think about Aptamil, which is one of our brands, and infant formula, I might be a first-time parent thinking about what infant formula do I buy. I still might speak to a midwife or a health visitor or even a pediatrician. So in our world and in our as our agency proposition, the role of the healthcare professional is one of a credible influencer as opposed to a prescriber or decision maker. Therefore, we don't engage with prescription medicines, we don't engage with prescription brands, but though that area of health and wellness where we are making as individuals our own choices and as consumers, that's a space we play.
So it's interesting that you say that. But, I think you mentioned the healthcare division, the consumer healthcare division doesn't deal with RX products. But what's interesting in my career trajectory, and I'm sure yours as well, we've seen loads of products go from RX to OTC, Loratadine. There's now birth control available over the counter, all sorts of things that I used to, Nasonex, the inhaled nasal steroids. So all sorts of products that used to be, for lack of a better term, gate kept by clinicians. You needed a prescription. You can now just buy. And then you have all of the hims and hers and folks where, you can get a lot of your products. It's, yes, you have a doctor, but you talk on the phone for 30 minutes. And really you're talking to them just to make sure that they give you what you already decided you wanted, which is really different than going into a doctor and a doctor saying like, I think you need, I don't know if any doctor ever says you need a hair loss product, but you know what I'm saying? Like, it's a very different dynamic. I mean, I want to talk about that a little bit. How are consumers reacting to sort of both the opportunity and the burden, I guess, is how I have viewed it for a long time. Certainly, you don't want to be making your own healthcare decisions around your prostate or breast cancer, right? Like there's an absolute line there. You're never going to go to the cancer-o-matic and pull out your own sort of carboplatin. But, where's the line? It's clearly moved that we, to your point, are taking more and more of our own healthcare choices, decisions, spend, into our own hands. Like talk about that a little bit. Like what's it mean?
Yeah, I think we've got to think about, what's driving that, and also how accessible it is now too. We've seen huge pressure on healthcare systems around the world, whether that's through affordability and equity, or whether it's through, like in the UK, for example, an increasingly creaking NHS system. So for a start, there's a point around access, speed of access, availability of healthcare provision. And then I think there's increasingly this stuff's available at your fingertips, whether it's devices that have got diagnostics. I was just reading just the other day, I think the Apple Watch has just had fresh FDA approval for new diagnostic tools and features for AFib. So it's there. It's at our disposals, at our fingertips. And if somebody has an interest and an inclination, it's there for them, and it's becoming increasingly accessible. So I think that's a key driver to choice. And then you mentioned there around some of those other products and brands, I think are doing a really good job of packaging themselves and their categories of products that they have to offer. I've been impressed by Hims and Hers because I think they're reshaping how they sell their products, right? It's not just about portfolio of products in a particular area and you having to navigate to get to there. They're basing it on your lifestyle and your life stage and being able to offer a suite of products. And I think that's really, really smart because they're connecting to me as a lifestyle brand as much as a health brand.
Yeah, it's funny. This might be a little inside baseball, but basically, a lot of times we organize internally around our own sort of needs, like we have a sales force and something like that. Not we have a user group. And I think the nice thing about Hims and Hers is it really focuses on, well, what's the needs necessarily of this guy? This male, this female, right? They are Hims and Hers, so they are gendered specifically. What's interesting is they also tend to sort of pitch to preconceived notions about what male and females need, because it makes my wife crazy that every time there's a Hers ad, it's all about her emotions, and every time there's a him ad, it's all about his performance kind of stuff. So there's something there, but it's interesting. They did organize around audiences as opposed to manufacturing processes, right? So something like
Absolutely.
Merck Vaccines sells vaccines for people who are 85 and newborn. It's really about the fact that they manufacture vaccines. They don't think about like, well, we have a suite of vaccines for the retired, shingles and the rest of it. And then we have a suite of vaccines for children and we have a suite of vaccines in the middle. I mean, they do. I don't want to reduce it to nothing, but it is interesting. I mean, it is a consumer driven space.
And then their needs are changing, and I think brands are having to adapt to that. If we think about health and wellness in its broadest possible sense, there's a lot going on there. We 10 years ago, 15 years ago, we defined that as diet and exercise, right? Health and wellness as an individual, as a consumer, diet and exercise. And of course, we then had our calorie counters and our exercise trackers that started to emerge, and wearable devices and so on. But now when we think about what else we've got, the data, the ability to track and monitor, we talk about sleep, we talk about gut health, we talk about skin health, spiritual and mental well-being, all of these things we can now tap into and be consciously looking at improving or tracking how we're feeling in those spaces or how well we are in those spaces. And I think brands are increasingly having to adapt there. If you think about the evolution of a gym, which, again, 15 years ago would look very, very different. Brad's flexing for those that can't see. It looked different, very, very, very different 10, 15 years ago than it does today, where you've got much more kind of wellness spaces and mindful spaces. And mindfulness is such a big growth area. And I think as we see generationally as well, the Gen Zs, the health and wellness is such an important trend for them. I think Instagram have done some research saying it's going to be the number one focus for Gen Zs, that health and wellness improvements.
Yeah, that's really interesting. I mean, something that I think obviously you have a ton of experience with, branding in general, and I think Brad, I don't know if you mentioned it in this conversation, but has definitely mentioned it before. As patients, being consumers, you're a consumer of a product that you don't want to be a consumer of, right? Like no one wants to need this medication. But when you think about more like health brands and like the non-RX and more of like these wellness brands, I feel like that's tied more to like, even the baby formula example that you used. These are products that you do maybe you want to be a consumer of. And a lot of it is tied to like your self-identity. I want to get into from a behavioral science standpoint just a little bit. Like when we think about patients from a behavioral science standpoint, belief, identity, it's a different sort of landscape than consumers for like more of a consumer product. So for example, like the Aptamil example that you used, as a mom and as, going to be a new mom again, I feel like there is this like you almost have this like self-image and this like self-identity of like, am I a mom that's using, especially if you're living in the US, like US based formula brands or European formula brands? It's almost become like a trend. And then you're like, kind of deemed as someone who's really like up on the latest in health. You want to give your baby the best because you're doing something different than everyone else. And I don't know. So how your self-perception, does it play a bigger role, and like how so in like consumer health versus like traditional health?
I think it plays a role in how engaged people are in their own health and their own health choices. There are people that are really, really into it. They've signed up to Zoe, they're on all of the sleep apps, the mental health apps, the mindfulness apps, people that are really tapped into the idea of what does their version of good health and wellness look like. And again, that's very accessible. So there's people that are really into it and making adjustments to their own health and their own behavior to improve and enhance that health and wellness. But I think the other element is the endorsement, the engagement that you seek when you're making these choices too.
Mm-hmm.
So, we're seeing a lot of the role of influencers and social media and communities. We've seen a massive rise in the role and the prevalence of the HCP influencer as well. So we do a lot of work with Galderma in the aesthetic space, and the derms that work in that space are huge, massive amounts of following. Their profile is really important to their business, but they're also very accessible and out there, putting content out there around their recommendations for certain treatments. So I think we're still looking for that, in many ways, that credible, authentic point of view, endorsement, support, recommendation, whatever it might be. It's just showing up in different forms. So back to your point, Brad, before about going to the doctor, getting the doctor's advice and that forming your decision, or indeed being prescribed. The dynamic shifted now. You know, we are there, we have all this information at our fingertips, and we have the professional endorsement or support or credibility that comes from these social communities and peer groups.
Yeah, it's something I used to talk about a lot is experience by proxy, right? So the idea that, you know, or what Sanika would probably call social proofing, right? I mean, everybody coins their own terms, but the idea that you don't want to buy, Sanika was just flashing me back 20 something years to when we had to buy a stroller. And it's like, do we buy a European stroller that's expensive
Yeah.
and fancy, but we live in a sort of down market neighborhood? And do we buy like a crappy stroller, but it's really hard to get in and out of the car? And I don't really care what people think, but I actually kind of do. And so
Yeah.
it was interesting, you know, you go online and you just find people who appear to think like you do. What did you buy? How did it work for you, right? You find that replicated these days online for breast cancer and for lupus and for, you know, all sorts of conditions, ADHD. Did you try this? Did you try Alzheimer's? How did I get the keys from my dad? That kind of stuff. And it really has opened up the world to sort of a push and a pull. The pull is, these are your peers, or at least you think they're your peers, and you trust them. You know, these are people like me. They think like me. They act like me, and they're facing the same decisions I am. The push is, we just don't have that much time with our doctors anyway. We hardly know them, and so it's become so transactional at a medical level that relying on literally a peer group of strangers online is better than no one at all. And that, I think, speaks to something that Sanika and I have talked about a lot off the air, I think, which is it's a radical shift to think of yourself as a consumer as opposed to a patient. I mean, even the semantics of the words, you know, a patient is an undergoer, a consumer is an agent. And so you're doing something as opposed to having something done to you. And I don't think the healthcare system as designed right now is educating doctors to service consumers. That's not how medical education works. You're working on patients. And it's shifting, but it's shifting slowly. I mean, there's a question in here somewhere. I guess, you know, like, what's our role in this sort of evolving landscape? It's uncomfortable. You know, Walmart just pulled out of the consumer healthcare space. It's not a slam dunk. It's not easy. Transition and disruption are hard. I think people are finding themselves both excited and exhilarated, but also a little bit overwhelmed by the sort of choice thrust upon them. I've sort of hinted at that twice now in the podcast. So maybe talk a little about that. Like, what does this mean for the changing nature of healthcare and relationships?
I think, you know, huge amount of choice, and I think choice can be really healthy. Choice can be useful. Choice can be empowering. As individuals making our own choices, it's great to have those options, but you are continually looking for a way to navigate through that choice. And I think that's where brands have a role to play, both through their direct engagement with consumers, but also engaging with some of these infrastructures that already exist, that are authentic and credible, and spaces where the consumers are already. And so I think that's a key role to play. I think the other thing I'd say is, we know that consumers are seeking that opinion or that advice. Intel did some research that suggested 69% of American consumers look out for that advice and opinions before making purchase. 69%. So that's huge. And so, you know, we don't make decisions in isolation. You know, we make decisions, we have a form a point of view, but we are looking for validation. We are looking for an opinion to validate that point of view for it to be the right thing. And maybe that is in the absence of that direct HCP conversation. We talk a lot about influencing the influencers, or a web of influence. So how do we start to map out and identify who are the individuals or sources that are helping individuals to shape their opinions, because they will seek that advice, and much to your example of baby stroller, you'll get a point of view from the people in the store, and maybe fellow parents, and maybe your parents that have gone through it as well. So you're always looking for that validation and that social proofing. So yeah, the choice, but the validation of that choice becomes really, really important. I think the other key thing that's worth highlighting here is the speed and accessibility of this. We've gone from talking about creaking healthcare systems and how inaccessible healthcare professionals are these days because of the stretch, right through to in a consumer and social space where it is literally at your fingertip. So I might be in a social media environment, engaging with my peers, engaging with brands, serving up relevant, meaningful content because they've been able to tailor or personalize it to me. But then I can also go through to purchase. So we talk a lot about social commerce. Right? I can literally be engaged, entertained in a conversation, and then I've got the opportunity to buy there. So the streamlining of the journey right through to purchase has become really, really condensed. I can be hooked in, engaged with a piece of content, next thing engaging with an influencer, next thing buying, all in a fairly short space of time and on my phone. I remember the days when, traditional advertising, you'd have to remember the URL code or the website address, and then you'd have to go home and find that and search it on your laptop. It was many, many stages with many, many opportunities for breaking down in that journey. The customer journey now is so rapid and instantaneous, and really kind of self-fulfilling and gratifying. So I think that's got a massive part to play as well.
Yeah, I mean, I think I definitely think it's fair to say that I'm sure some HCPs like in traditional health roles, they're sort of like, opposed to how, this is moving into more of like a business like structure. But it is, I feel like the lines are blurring because even traditional healthcare with like the whole like concierge service that a lot of these practices are doing, it's like how do we get patients, to be able to be seen when they want to be seen. We're here for you 24/7. It's almost like the support you get from like 24/7 support for like a certain brand. I feel like they're kind of mirroring each other and realizing that like that's where it's headed, even in like with your PCP. So I don't know how I mean, doctors might be reluctant to it, but they're leaning in because I think they realize that's where this is going.
I think they can lean into it. I think they've got a role to play in it. I think done well, and I use the example of dermatologists in the aesthetic space. Done well, they can engage with their audiences, many of them, by the way, in new and interesting ways. They don't have to rely on a one-to-one conversation, whether that's done in surgery or in a telehealth call. They can do this at mass. Some of the followings that these dermatologists have go into hundreds of thousands. So I think that done well, they are leaning into it. Done well, they are realizing the potential of these new media and channels to engage with their consumers or their patients.
I think there's also a tension between professional expertise and consumer-driven care. It's not unlike some of the discussions I have with academic colleagues where you spend your whole life or a chunk of your professional life studying something. I'm reminded of my professor, John Rickford, who I've mentioned before, spent, I don't know, his whole life really studying African-American vernacular English and different varieties of it. And I was in San Francisco when the whole Ebonics thing blew up, when the Oakland School District asked for money from the federal government for second language English students because the students, quote, spoke Ebonics. Now, the thing about that was they were trying to get money from the federal government for what is arguably the worst school district in America in terms of outcomes and resources. So they were trying to do a good thing. But what I remember distinctly at the time was two things. Number one, John Rickford had worked with them and they never went to him. They just coined this term, and he'd spent his whole life working on this. And two, when they did get John on a television channel to ask him about it, they cut away from him to some dude literally stepping out of a train going, "And what do you think?" And this guy was like, "I don't like it." And they literally gave them equal weight. And I think that was very hurtful to John and to those of us who sort of go like, but wait, we actually have a different opinion on this, not because we just stepped off a train, but because we've spent tons of years studying this. I think there's a sense of that for doctors. I know that was a bit of a long anecdote, but it's a very, very applicable one where you're in this space where doctors, I think there's a little cognitive dissonance that they're being evaluated on how well the coffee was served, while they were in hospital, not I've kept my foot. On the same side, though, I think there has been just a natural move away from like, well, trust the institutions of authority. They've given us no reason to trust them. They've abused power. They've abused all sorts of stuff institutionally, certainly not every doctor, but I'm just saying we as consumers don't trust expertise the way we used to, not in a hospital setting, not in an academic setting, not in any of these settings. And so I think there's a bit of cognitive dissonance. I think the doctors who've done best in this recognize what the shift is and what it means. And at the end of the day, to have healthy patients, which is what your calling really is, you have to get with the times. I think those who are hoping to be a sort of king or queen of the realm are struggling. You know, they're no longer in charge. They're no longer the crown prince and princesses of hospitals and clinics. And that's disconcerting. And that's one of the things we do need to deal with. You know, I think it's difficult to advertise broadly products when one of the audience who's bound to see it resent that you're doing it. You know, a lot of doctors don't love that we do the kind of advertising we do, and they feel like it's sort of, I think it's going away, but certainly 20 years ago when I started interviewing about it, they're like, it's my job to tell the patients what drug to be on, not television's job. You know, now you don't do TV ads and really anywhere else in the world except here in New Zealand. But I guess I'll ask you, how do we manage that tension? Because at the end of the day, there is still a role for healthcare professionals, a massive role. None of us want them to disappear. I don't want to be on my own when I handed a really bad diagnosis, but I'm very comfortable managing my own chronic conditions, for example, and making my own choices. Like, what's the line that we're cleaving there, and what's the right role for us to play, Dan?
Yeah, it's I think it's a really interesting one, and it's continually changing. I think the increased because of the increased pressure in, you know, ER and emergency services in hospitals, we're seeing a push, aren't we, back through, for instance, more and more procedures happening in the primary care setting at local doctors' surgeries, more and more things happening within the pharmacy setting, and then indeed more and more things like managing of chronic conditions happening with the individual who can monitor and track and all of those other things, could be diabetes or whatever it might be. So I think we're seeing a need to push downstream some of that care and make sure that, you know, we're not overburdening those kind of ER, emergency hospitalization, surgeries, all of those sorts of things. So I see that happening. I was in a workshop with a client and it brought a lot of laughs at the time. This is probably going back, I'm tempted to say 9 years ago. And I dared to suggest that I could imagine a time where primary care doesn't exist, because we would go from diagnosis and having the equipment and the data and the wearables straight through to secondary care. You know, you think about the very definition of a GP in English terms, general practitioner. They need to know a little bit about a lot of topics and ailments and conditions, most of which we now have accessible on Google and, you know, other social channels and whatnot. So I could imagine a world, and I still can, where the role of the GP has to change or becomes obsolete, because I would go from having my diagnostics, knowing where I am, having the data, potentially being as informed as that GP about the thing that I've got, the condition that I've got, and then my direct interaction with the specialists. So I think the technology is going to continue to drive, perhaps more radically in years to come as well, the shape, or what we consider to be the shape of healthcare provision as consumers, pharmacists, primary care, secondary care.
Amazing. Thanks, Dan. I mean, I think I always say this, but I think there's definitely a part two to this conversation, which we kind of started touching on in the beginning. And that's more of like, again, getting more into like the branding aspect of it. I think that's
Yep.
definitely something our listeners are want to listen to or hear about. But I think this is great. I think it's an important distinction. You know, how do we navigate? We do patient marketing, and then we're now shifting into consumer marketing. What are some important differences? How do we, as marketers, do a good job at communicating differently, and taking into consideration those, like, I mean, not really nuanced differences, but significant differences in the experience? Anything that we didn't touch on that you think is important in this conversation, and then one important takeaway that you want our listeners to kind of end on?
Yeah, thank you. I think there is one that very much speaks to what you've just described there, Sonika, and it's about authenticity. The strategy team in my agency have just been doing some work, and one of the trends that they identified was radical authenticity, and that's to say, and they came up with a great stat: 20% of consumers and actually 30% of millennials have unfollowed a brand on social media based on the fact they didn't feel their content was authentic. So I think it's not just about how and where we show up, but the authenticity that must come. I think there's a kind of counter movement away from the glossy ads that we see on TV and Super Bowl and so on. That's great, has a place, but I think people are looking for that real connection with brands, real authenticity in how they're being communicated to or with through these social channels, and it's an engagement rather than a push communication. And so I think that authenticity is going to continue to play a role. Does something look almost too polished, and as a result, am I rejecting it as a consumer because it doesn't feel like it's quite for me? It's not human enough. It's not connecting with me on an emotional level. And so I think we're going to see, again, what good looks like and what's effective continue to evolve as we see influencers and we see TikTok and Insta and all of these other channels and many others to come for sure, that are looking to be more and more authentic in how we communicate with our consumers.
Yeah, I mean, authenticity is something that we've done a lot of research on. So, I mean, I would also love to have a conversation with you on like dissecting that term. Like, what does it actually mean to be authentic? Yes, we know that the output of authenticity done well is, feeling that connection, that long-term engagement, that loyalty to a brand. But like, how does a brand actually deliver on that? And I think we've seen brands try and fail. And, so I think would love to pick your brain a little bit more about what that looks like. What does good look like? And also, our clients are always asking for examples. So I think that that's great.
I was just going to say, I think authenticity for me is two parts. Is it authentic to the brand in terms of what that brand stands for, represents, beliefs? Again, we've had lots of brands fail dramatically because they've tried to latch onto a movement, or it's cause washing or whatever you want to call it. So is it authentic to me as a brand or our brand? And then secondly, in the execution of the communication and the channels that we're using, are we using them in a way that creates an authentic connection with our audience and their wants and needs? But even in execution, is that done in a sometimes non-polished but very real, authentic way? And a lot of what we've talked about as Havas Consumer Health is really getting under the skin of our audience, because these people, our consumers, are making decisions all the time about their health, right? And I'm doing it on a phone while I'm sat on the toilet in the morning, and I'm doing it on the bus on the commute to work. That's the reality. We're not making very pragmatic, logical choices in a continuous fashion, and it's a linear journey. We're making these choices all the time on the fly, and we're able to be influenced all the time and on the fly. And by the way, those choices can be really fragile as well, because often use the example, I might go in to the supermarket to buy brand X for a migraine and a smart bit of point of sale, and I'm buying an alternative product. So my choice can be influenced quite easily. So we talk a lot about fragility of choice and the idea that these things can be influenced. But if we truly understand how, where, and why individuals are making choices about their own health, we know how they're doing that. And if we're able to then introduce our clients' brand in an authentic way, I think that's where we've got a role to play in terms of supporting those brands.
Yeah.
I just want to point out, it's really interesting. There's a continuous tension between craft and authenticity, and it's sort of like buying pre-distressed jeans or something like that. Like the craft is in creating the flaws these days, right? Like too smooth, not going to work. You got to break the fourth wall, or something's got to be wrong, or like it is an interesting moment. I mean, Anika and I are fascinated by brands, by authentic brands. What does that even mean? I mean, we have a lot more to talk about in version 2. So Dan, we're definitely not going to let you get off with just showing up once. He's the busiest man in showbiz, people. He's been hard to pin down, but he's here now, and you heard it here first. He'll be back. So,
I'll be back.
This has been great. Listen, super fun talking to you. You're just great company, no matter the context. But it's been great having you on, and really enjoyed it. And like everyone, look forward to the next one. But for now, on behalf of Dan Weaden and the Havas Consumer Healthcare Group, myself, I'm Brad Davidson.
I'm Sonika Garcia. Until next time.
This is Breaking the Code. Till next time. Bye, guys.
Bye, everyone.
Dan, did you just wave?
I don't know why I was waving. It's
just
like it was
put
recording.
That clip just of him waving.
Yeah. I don't know why I waved. Having just been clearly told, yeah, it's not recording, I waved.
Breaking the Code is a podcast created and produced by Havas Health and U's Medical Anthropology Department. Hosted by Brad Davidson and Sneeka Garcia. Content and post-production audio editing done by Gabriel Allen Cummings. And inspiration from all of you. Thank you for listening and for your continued support. If you enjoy these episodes, we would love to hear from you. Please leave a rating, subscribe, and send us a message to our mailbox at medicalanthropology@havas.com. Until next time.